Ensuring safe roads and swift response in the advent of emergency situations is a need and concern that shouldn't be taken lightly. This is something government agencies should collaborate more with private organizations to ensure that the right attention is paid to emergencies that can occur on our highways. This is the drive that Health Emergency Initiative, HEI, a non-profit humanitarian organization that pays the hospital bills of indigent patients and provides other interventions for vulnerable people in public health institutions and communities, is all about. HEI also gives timely support to patients who require emergency medical attention, especially post-crash care for accident victims, as well as provide certified training to the citizens on first aid, CPR, AD, and crowd control. Joining us on the show to discuss the collaboration between Health Emergency Initiative, Lay First Responders International Michigan, and Federal Road Safety Corps of Nigeria is the duo of Pascal Achunine, Executive Director, Health Emergency Initiative, and Haley Elmore, Operations Director, LFR International, Michigan, USA. Good morning and welcome to the morning show.
Thank you. Good morning. Thank you for having me. Good morning, viewers.
All right. Fantastic. I'll throw this first question to both of you. Fantastic work HEI is doing in terms of paying and looking at crash victims. Please tell us a bit more in terms of your collaboration with the Federal Road Safety Corps and this collaboration with Lay First. And for Haley, I'd like to ask you, why did you agree, what's in this partnership, why is it important to Lay First, and how do you come in? So I'll start with you, Achunine, with regards to your, telling us a bit more about your collaboration with the Federal Road Safety Corps and with LFR.
Thank you once again. I'm glad to mention that we moved from wishing, or maybe everybody wants to postpone the problem. You see issues and everybody's postponing. So 7 years ago, we began this journey by working with Lagos State government hospitals, paying the hospital bills of indigent patients. And when it began to gain traction and the systems we are producing outcome with huge impacts, we went into, in 2017, June, we signed an MOU with Federal Road Safety Corps, National Orthopedic Igbo, BFM Cebu Temeta, and then Ministry of Health, on behalf of Lagos State government hospitals, came into that collaboration. The idea was to ensure that the first 24 hours when a crash occurs, the victims could access care up to 30,000. That was in 2017. Over the years, 2 years ago, specifically, our board increased to 50,000. So there's what is called golden hours when during a crisis situation. It could be fire, it could be road traffic accident, it could be building collapse, or anything emergency. But narrow it down to road traffic accident, RTA, that first 24 hours, if help does not come within the golden hours, most of the victims, especially 50%, die. So that MOU required that any of these agencies, the police, Federal Road Safety Corps, LASAMBOS, LASEMA, and recently LASMA and some emergency responders we trained. When they are taken to the hospital pays, stabilizes and sustains them until the first 24 hours, until working with the social workers, we could reach the next of kin. We have had over 82% survival rate. And this is against the backdrop that more than the third leading cause of death in Nigeria today is road traffic accidents. So this is a time for us to do more to save more lives.
Brilliant. Thank you very much. Haley, your partnership with Health Emergency Initiative, HEI, why is that important to you? Where do you come in as LFR?
90% of the African population has no access to emergency medical services, and specifically Nigeria has the most limited access. But we found that emergency medical services can address up to 54% of deaths caused by trauma. And so at LFR International, we leverage the existing existing infrastructure of transportation providers and training them in basic first aid and trauma care. So when accidents happen on the street, they can quickly attend to them and provide that life-saving care. And we found this model is more cost-effective than 99% of other health initiatives. And we're very grateful for our collaboration with HEI. As of now, we've trained almost 650 lay first responders and plan to train many more.
Okay, let me start with you, Pascal. If you can help us understand, what is the quality of or percentage or the numbers that we can have in terms of the response that we get in Nigeria to emergency calls? Let's say, for example, in Nigeria there is 200 emergency situations like accidents. What's the percentage of response that we get? Because we see a lot of accidents on the road, Pascal. We see a lot of accidents on the road, and sometimes you don't see anybody helping them. So do we have numbers in terms of how quickly we respond to them?
There are some figures that are out there. Some of them are official. Some give the picture that people exposed to emergencies receive care at 15 to 30 minutes, sometimes 45 minutes from the time it happened. We do not have empirical validation for that. If you go to other countries, Israel, for instance, it's about 3 to 5 minutes. Most countries that have designed a model that works for all is about 10 minutes maximum. The tragedy is that we don't have a national emergency response policy. We don't have a national ambulance policy. And it's also good to give credence to the team, especially the ones we've engaged in Lagos Federal Road Safety. We see significant level of moving the victims when it happens in the urban areas. Yeah, there's also a knowledge gap because the bystander, the average citizen, they are constrained by a number of reasons. One, if we take a survey now, how many of us know the emergency numbers in Lagos? 8 over 10 will say is 911. The knowledge, getting to know that if you call 767, the emergency number in Lagos, and 112 or 122 for Federal Road Safety, that knowledge alone can constitute 50% survivor enhancement for a victim. But again, we also recognize that there are massive instances of taking these victims to the hospital and they say no base space or no, they lock their gates. So bystanders are constrained by they're afraid that the police or the law enforcement agents will say, oh, if you're rescuing someone, that you're responsible. So they are afraid of the likely harassment that may come from law enforcement agents. There's also the issue of when you get to the hospital, you will not be allowed to go except you pay. So that has affected, there are so many times people who would have survived because the bystanders are not willing to render help. Or they are willing, but they are scared about what will happen. Most importantly, they don't have the skills to provide this, whether it is CPR or other skills required. They stand aloof. They be taking pictures and videos and putting on social media. So what we have tried is to demystify that process. We engaged the Commissioner of Police and his team. They provided a number of policemen who trained till date on Friday, tomorrow. We're doing an additional 13 in their premises. The goal is to build a large community of TOTs, policemen who have capacity to even train their people on how to engage the citizens and what to even do among themselves. And then we narrow it down to VIO, the LASMA, the civil defense, and of course Federal Road Safety, and other institutions or agencies that have things to do when it concerns the emergency. We have empowered a significant number of them. We wrote to them, they sent. And we also felt that the culture is a cultural thing, that students at secondary and university level require these skills. So we got approval for Lagos State, for instance. We got the Commissioner of Education approved that we train senior secondary school students in Lagos. So from King's College and the 6 educational districts, we have not only trained them, we have set up first responders clubs so that the knowledge can permeate, they can cascade it among their members and other people in the students community, and they embrace the culture of saving lives instead of taking pictures and videos and putting on social media.
Okay. So let me ask you then, Haley, in terms of the top 3 things that LFR is bringing from Michigan to Nigeria, what would be the top 3 things that you think Health Emergency Initiative, the FRSC in Nigeria, top 3 things that they need to learn very quickly that would impact on saving lives in Nigeria?
For first responders that we're training? Yeah, so there's a lot of valuable information in our course, but I think the most important is calling for help. So we emphasize, like Pascal was saying, that 767 and 112 number, and calling for help instead of recording those incidents, being able to actually intervene. And then we also teach the ABCs, so airway, breathing, and circulation, which are kind of the most important life-threatening injuries that can occur from these traumatic accidents. And so we teach them how to kind of open the airway, check for breathing, check for circulation, because if any of those are compromised, the patient might be facing more imminent injury or death than if they weren't able to intervene. And then the last thing we teach that's very important is scene safety. So with the roads, there's always a lot of cars going by, there's a lot of people and crowds, so just being able to manage that situation and instilling the confidence in those responders to be able to take control, tell this person to go call, this person to kind of stop traffic, and making sure that the responder is safe, because you never want to put yourself in harm's way.
So the interesting part is you can do all of this, do a good job as being a first responder, but you still go to a hospital that they say, oh, we don't have the capacity to take on this case, and the person still eventually dies. I'd like to come to you, Pascal, then first, and afterwards, Haley. Is there a synergy where you can know, okay, hospitals and specializations for different, accidents or mishaps?
Yes, so that is a beauty, the sweetener. There are many institutions that conduct this training here, but they don't have this component we have. We call it integrated strategy. The MOU we signed with all public hospitals in Lagos State positioned us, and the collaboration with FRSC we have, that when an accident victim is rescued by the bystander who has a skill, or the emergency agency, the road safety policy, etc., they get to the hospital. We have social workers in those government hospitals that ensures that once the victim is brought with critical injury, not somebody that has a bruise, that victim accesses care, and we pay up to the tune of 50,000 to ensure he or she stays alive. So that comfort makes it very convenient, so to say, for the personnel or those, whether it's last suit, whether it's FMC, Butemeter, and whether it's trauma, burns and trauma, they receive the victims, stabilize them, because within 24 hours, our organization will fund them, support that victim each with 50,000, non-refundable.
Haley, you want to chime in on that?
Yeah, so we equip all our first responders with a vest with the FRSC, HEI, and LFR logo on it as an indicator of their level of training, and hopefully will show everyone around them that they have those skills and that they are just providing as much care as they can. And in addition, we train the police and the FRSC officials, so they're all on board, like Pascal was saying, and we'll be able to identify those responders. And lastly, as I was saying, we definitely instill confidence in these people, so when they get to the hospital, they are trained to express what happened and what injury occurred, and kind of what care the patient will need to the hospital as a further continuation of that handoff.
Excellent. Thank you very much, Haley Elmore from LFR International, and of course, Pascal Achunine from HEI.